tell us a little bit about what Hovis Associates does, Kevin.
So we are a family-owned independent insurance agency. My dad started our company in 1984, and we have pretty much we started down in DeSoto, Missouri, southern Jefferson County.
Sure, yeah.
And now have grown to office in Festus and St. Louis, and have about 250 Medicare agents that work through our office in Missouri and Illinois.
Yeah. So what do they do? They look.
So basically, you got to, when someone turns 65 or is first eligible for Medicare, there's lots of options for your Medicare plans. So the way we do it is we are purely independent. We can sell every single plan that's available. We always try to do what's in the client's best interest. So we gather as much information as we can prior to meeting with the client, a list of your prescriptions, list of your doctors, what hospitals you want to go to. And then,
why are those things important?
Well, because not every plan covers prescriptions a little different. Not every doctor takes every plan. So, for example, in St. Louis County, if you're looking at a Medicare Advantage plan, there's 41 different plans available. Well, we don't need to talk about all 41 plans because they may not all work for the individual client. So we do our homework prior and try to figure out what's the best plan for their situation.
So trying to navigate through the Medicare minefield, somebody doing it themselves, it could be pretty costly for them if they don't have professional advice.
Yeah, if they just go online and try to figure out things themselves, which a lot of people think they can, you may end up on a plan that doesn't cover a certain prescription that you're currently taking. You may not be able to see your same doctor that you want to see.
And plans change year to year.
A lot of plans change on a calendar year basis.
Right.
So, you may be on
you wouldn't know when to get out.
You may be on the right plan for you for 2021,
right,
but it may not be the best plan for you for 2022.
I say this all the time with my tax guy. Why would I want to try to spend an afternoon or probably like several weekend afternoons trying to figure this out?
And it happens when we meet with people all the time that they're turning 65 soon. They know they need to do something with Medicare. They don't really know where to go and where to start. So they start investigating themselves, and the next thing they know, they're reading books, and they're more confused than before they started.
I did the book thing.
I'm sitting over here looking at Guy. I'm like, dude, just call Kevin.
Right.
Why would you ever get a book?
I know.
What is your training in Medicare and insurance plans?
Nothing. But I am a guy, and there are a lot of guys like me. I mean, I like the financial world. I like the Medicare. I like to be in control.
I can figure this out.
I can. Yeah, maybe. But
how'd it go?
It was awful. It's awful. Now, I'm not giving up any trade secrets, and I don't want to tread into an area you don't want me to. But I think a lot of people try to do the Medicare thing themselves because they think it's going to cost a lot of money to see a guy like you. Tell us, how do you get paid? What is your financial
So the way
interest?
we get paid would be if we help enroll somebody onto a plan, then whatever plan that we enroll them all on pays us.
Sure. So you're like a travel agent, really. Right?
Basically, yeah. So we're a broker. We connect the client to the company, and the company would then pay us.
If I come to you, I'm not going to be cutting a check with Kevin Hovis' name on it.
You will not ever write Kevin Hovis a check.
Okay.
No.
Unless you took Kansas City.
Yeah. Oh. Do you take a personal check on football bets?
That still hurts.
And what was the spread on that one again?
7.
Exactly.
So, Kevin, last time you came in, we took calls, we took texts. So, Guy, what's the number again?
84126.
That's the text line number.
Oh, you mean the phone number?
The Woods Basement System text line.
84126.
And what's the phone number?
314-931.
Yes.
KTRS. 931.
We mentioned this in the last hour. Somebody already texted us.
Okay.
So probably middle of last hour. Hopefully they're still around. This one's for you, Kevin. I would like to know, what is the best individual dental program? We have a supplemental plan G for Medicare. Thank you. Now, I don't know. I mean, number one, I don't know what any of this stuff is. And sometimes I think even when people are on certain plans, they might not use the right terminology.
Sure.
But dental plans, and they seem to be on Plan G currently.
So they are currently on a Medicare supplement Plan G, which supplements original Medicare for their medical coverage. Okay. So original Medicare pays first. The Medicare supplement Plan G pays next. Now, original Medicare does not include any dental, vision, and hearing.
Okay.
So a lot of times people that have a Medicare supplement will need to enroll in an individual dental plan to get some enhanced dental coverage. Okay.
So what does original Medicare cover?
Basically just your medical coverage. Part A covers hospital.
Yeah.
Part B covers doctor services.
Okay. So like if I went in, what was the last time I went in for? Let's just say colonoscopy. Is that covered by Part A and Part B?
Yes, it is.
Okay. So
Like
your
I told
standard
you,
stuff.
I went in and I had a knee replacement about a month ago.
Yeah.
I just got my Medicare statement yesterday, and it said, it was $12,700. Your part, zero.
Oh, I love when that
Zero's
happens.
good.
Zero is the greatest.
It's the greatest number out there.
But let's step way back.
Wait, hang on.
Oh, I'm sorry.
For the texter's question, when they say what is the best dental program, is that subjective?
Like I said before, we're purely independent. We sell every type of Medicare plan that's available. We also sell a lot of individual dental plans. So, same kind of thing. The same way we would do it. What dentist do you want to go to? We would look that up, figure it out. Do they need some coverage immediately? Most of the time when somebody's wanting dental coverage, it's because they're going to have something
already
wrong
have an issue
pretty soon.
Yeah.
So we want something that wouldn't have waiting periods. Okay? So that's kind of
Are
how
there
we would
waiting
figure out
periods?
would be what's
Are they
different.
designed specifically to catch people that say, I need
Different,
Kevin, I need some
different
dental
plans
work.
work differently. So that's
Yeah.
why we want to gather that information
How many
prior.
dental plans can possibly be out there?
A lot more than you would think.
Yeah.
Yeah. So
What about hair growth? Is there any?
obviously, I haven't found that plan yet.
Yeah, right. Asking the wrong guy. Kevin Hovis is our guest, Vice President of Medicare Sales at Hovis Associates, talking Medicare today. And I said, let's go way back, way back. I'm 25 years old. I look at my paycheck. There's a deduction for Medicare, on every paycheck. Every single paycheck I get, that's, is Medicare. So is this now it's my turn, I retire.
To get the benefit.
I paid in, I get the benefit.
Right.
So people, I look at this and I think, how is it I could go to a hospital, have major surgery, and have no expense on this?
Yeah.
But I paid into the system.
Correct.
Paid in over the many years, and it's hundreds of thousands of dollars because doesn't the employer kick in something as well?
Yes, but then you also, you're still paying for Part B of Medicare every month, which automatically comes out of your Social Security check. If you're
correct.
Yeah,
That's
before
correct,
you even
yes.
see it, they
Right.
take it out.
So you've been paying into it
Right.
all these
You
years while
still
you've been
are.
working.
Right.
But even now that you're on it, you're still paying every
continue
month.
to, yeah.
Right.
And that price is going up, but only a little bit, right?
Well, for
Just
example,
for
in
inflation.
2021, the Part B premium was $148.50, and for 2022, it's gone up to $170.10.
74 or once. Okay.
So
Yeah.
it's
But
pretty
that's
good
inflation
sized
or
jump
whatever.
from year to year.
Yeah.
It usually hasn't gone up that much.
But don't they, isn't that a cost of living increase?
Yeah, so a lot of times they'll raise your income,
Right.
but then they'll take it back on your Part
Sure,
B.
of course.
Social Security goes up too, though, right?
Well, that's what he's saying.
Yeah.
They'll raise your income.
Your income
Right.
being Social Security.
But then,
Correct.
More questions coming in off the Woods Basement Systems text line. I will turn 65 in April, but plan to continue working for a few more years. This is the question we had in the office. I have insurance through work. Do I still need to sign up? Someone else texted in, same question. Do I have to sign up at 65 if I'm still working?
this is probably the most common question that we get for people that are turning 65, primarily because more people are working past 65 now than they ever have before.
Sure.
Okay. And the basic answer is if you stay on your employer coverage based on the size of the company, that will determine who is primary and who's secondary. You may need to sign up for Medicare, but you need to talk to your HR department for your employer plan.
Could you still use your employer plan for your dental?
Yeah.
And just have
So
Medicare?
a lot of times we'll meet with people that are retired
So I
or
don't need
are
to
retiring at 65, and they will not keep the medical portion, but they will keep the dental plan with their former employer.
And that's possible.
Yeah. Well, no, I mean, every group's different, so that's pretty much how I have to preface every answer.
Sure, right. Kevin, your clients, they sign up with you, and the plans, as I mentioned earlier, they change yearly. And if you want to change plans, you can jump over to a plan that suits you better. But is that something you do at Hovis Associates? Do you call your clients and say, hey, we noticed that you have this, but it's they're dropping this coverage or...
So the way we do it, so the annual enrollment period, which we just completed in December, runs from October 15th to December 7th. That's the largest opportunity when people can make a change to their plan for the upcoming year. We mail out paperwork to all of our clients in September just to ask them, has anything changed in your situation? Are you taking new prescriptions? Are you seeing new doctors? If you want us to review your situation, fill this out, send it back. We'll have an agent look over it, see the differences to your current plan, and maybe recommend there might be a better plan for your situation.
People turn 65 every single day, every hour of every day.
Right.
Whether it's January or September or November. Why is open enrollment once a year and then, am I stuck for the rest of the year? Is there
So when you turn 65, even if it is in July, you have 3 months prior, the month of, and 3 months after to enroll in a plan for the first time.
Okay.
But then once you're in that plan and you're in the Medicare system, then you start to work on that one time a year.
What if it's July and I want to change it?
Depending on the type of plan you have,
right?
You may not be able to switch until the next.
Interesting.
Exactly. So we talked about Hovis and Associates. We didn't really talk about where people can get in touch with you or how.
Well, our website is hovisandassociates.com. Our phone number for our St. Louis office is 314-380-2030.
This is radio. You always repeat it. Always repeat it twice.
And again, the phone number is 314-380-2030. And the website is hovisandassociates.com.
Somebody else texted in, if I sign up for Medicare Parts A and B, how much will it cost me monthly without a supplemental plan? Didn't we just answer that? Was it the $176?
Well, currently it's going to be $170.10, but you also would not have any drug coverage with original Medicare.
Prescription.
So you would have to add a prescription drug plan to that.
D?
Part D.
Part D is prescription. So
in Missouri, there are 22 different drug plans for 2022.
Oh, for crying out loud.
So that's why we would want to get a list of their prescriptions.
Why is this so complicated? I mean, if the government made this easy, I always say this with the tax guy. If they did that thing where you fill it out on a postcard and mail it back, he'd be out of a job. But, if they made this easier, we wouldn't need Kevin Hovis. But that's just not the case.
Which I'm glad they did make it complicated. So, but I can't have a job.
It's not like you came up with this. You just saw a need for it, and now this is your business.
And the way my dad taught us when he started was, as long as you take care of the clients, everything's going to work out in the end.
But why are there 22?
That's part of the reason we've grown so much.
Why are there 22 plans just in Missouri for a prescription?
Well, I mean, I don't work for Medicare, so I can't really answer that question.
Okay,
but
that's fair.
Yeah.
But you can navigate all 22 of them.
Yes, sir.
Huh.
How many different insurance plans? I mean, I look at there's Anthem, there's United Healthcare, the big ones.
Right.
But, there's ones I've never heard. Ed's Health,
Well, and that's we do the research on certain carriers and certain plans to make sure they're a credible carrier, and then they can take care of the client and pay the bills that come in. So we do all the research on that.
All right, I got another one. You got to follow me on this one, though. Turning 65. All right, they're not there yet. Very healthy, no medications, no anticipated medical costs. What an optimist.
Good luck.
Yeah. I would like to have dental and vision, currently self-employed and on Obamacare. I take a lot of write-offs on my taxes. Is income based on gross or net after expenses? See, this is a tough one.
Right.
So, I mean, for that person, what would you say? Come into the office.
Yeah, because
Let's
like I
talk
say,
about what you
everybody's
do.
situation's different. So we're going to need to analyze that person's situation, look at their income.
What should I bring with me?
Really just before we meet with people, we mail them out we call it the client intake form, the questionnaire. We gather as much information as we can prior. We ask what's your current coverage, because that's what somebody's used to. So we know what they're going to be more comfortable to. We don't want to move into a totally different type of plan than they're currently used to. They may not be comfortable with it, and
change your doctor.
It's not going to work out for them. Right. We never tell anybody to change their doctor.
Right.
That's why we always want to know who they currently see, so we can see what plans that their current
covered,
doctor takes.
I have to say, and I don't always give a high howdy to the government, but I got to tell you, since I've been in this program, I'm pretty impressed.
Oh.
I mean, if there's a change in anything, they let me know. I get I think the government spends too much money mailing stuff out, but they probably get a discount. That's my guess.
Yeah, wow. They know people at the post office.
Yeah. But you know what? And I've been in the Medicare program now 3+ years. I'm really impressed with it. But I will say this. I highly recommend somebody like Kevin or his staff to hold your hand and guide you through it. It is almost impossible for you to make the right choices doing this by yourself. They don't – certainly they make their living from getting policies for you, but they don't charge you for that. They get paid by the insurance company. So you're not going to go in, as we mentioned earlier, and write a big check to Hovis Associates. These guys have been doing this here in the metropolitan area for over 35 years. They're schooled. They know what they're doing. They're certified with all major Medicare plans, Hovis and Associates. Kevin, thank you for being on the show today.
All right, appreciate it.
Telephone number again?
314-380-2030. And the website.
No, that's 314-380.
Two times.
How many times do I have to tell you? And the
I
website,
guess it's 2 times.
Hovis, Hovis, and Associates.com. Look forward to seeing you again.
All right, thanks.